Bitte.
Hi, I'm Dr. Ed Jacobs, founder of Impact Therapy, here with Dr. Chris Schimmel. And we're going to talk about common mistakes that we think counselors make and are taught. I don't know if you want to, but the three we're going to talk about are reflects too much, listens to too many stories, and fear of cutting off. Let me comment, and then we can just, like that idea, I think you were taught this when you first came here, yeah, go ahead.
Well, I was, and in my first class that I had as a new master's student in counseling, we, for 16 weeks, reflected, and that's all we were taught. And it's good to learn those basic reflection skills, and you'll use them. But I think the idea that that's all counseling is about is reflecting feelings, and that sort of what even that Hollywood stereotype that counselors say, that must be very painful for you. Say some more about that. Tell me, what I hear you saying is, it's sort of that stereotypical counselor approach. It really can turn clients off, and it can be used in a negative way and not be helpful.
Yeah, I'll just play a role, and you can show it badly, maybe
Okay.
at first, and then we'll do.
So you want me to do a bad
Yeah,
example?
and then
Okay.
the same thing of maybe doing it better.
Okay, sort of an overuse of reflection. Okay.
Let's say I'm coming in to see you, and I just feel overwhelmed. I just moved here from Virginia. I've got a new job that they changed sort of what I was going to do from what I thought. My wife and kids are back in Virginia, so we've got two households. I'm not good at setting up a house by myself, and my wife can't come here, and we've been fighting even a little bit about that.
Okay.
And
So-
I just feel overwhelmed.
Okay, so what I hear you saying is you're real overwhelmed, you're moving into a new city that you're unfamiliar with, you're trying to maintain two households. I think I even heard you say that you're fighting some with your wife because it's a difficult situation with you being here and her being there. And I also hear you saying a lot about your job and how the job is not quite what you thought it would be.
Okay. In impact therapy, we talk about trying to get trying to have impact. Whereas, and we'll get you to do that again, I think, Chris, there's a lot of time wasted, really, with reflection. It wasn't that was bad, but it wasn't helping me, and it wasn't helping.
It doesn't help either of us,
Yeah.
really. Yeah.
So let's say I said all that. What would you?
What would be a more effective response?
Yeah.
I think I would respond to you more in something like in the following way. I would say, Ed, you've got a lot going on.
Oh, I do.
Yeah. How can I help you with? I mean, you said I'm going to go see Chris Schimmel, and and she's going to help me. What? Have less anxiety? I mean, is it less stress?
I need to sort out. Less stress. That's it.
Okay.
So what Chris did was reflect something, like you have a lot going on, but she didn't go back and parrot back everything that I said. So if you've learned that and you thought maybe it wasn't exactly the most helpful, we would agree, because we teach our students reflection as one of many, many techniques. Here's the other common mistake: listens to too many stories. Watch this. If Chris has heard me before talk about my girlfriend getting drunk and pulling a knife on me, and also the other time when she got drunk on Super Bowl Sunday and threw a beer bottle at the TV set, and so now I'm coming in to tell her, about my weekend. Well, let me just tell you what happened this weekend. So she got drunk again, and this was really embarrassing. So what I do is I find her.
Ed, let me stop you a second, because I think you're going to tell me another story about Susie getting drunk.
Oh, yeah,
and there
let
was
me
a big
tell you.
scene.
Yeah, and this
Okay.
one even involved the police. They came.
Let me stop you a second. Susie is an alcoholic. Remember how we've talked about that?
Yeah.
How
But
can I help you, given that this is who your girlfriend is?
Okay. Do you see the difference? I hope you do. And what we've got up there: listens to too many stories and fear of cutting off. Chris did not have the fear of cutting me off because she was trying to be helpful. Impact therapy emphasizes that the goal is to be helpful. It's not to just listen to stories. Because how long would I have gone on? How long do you think?
From your voice tone, and I always am gauging your tone of voice, it sounded like this story could go on a long time. Now let me reiterate something. If I had never heard any of those stories before and didn't have that background information, I certainly wouldn't have taken that
Right,
that
but when
approach.
you hear,
But when I know I'm going to get a third or a fourth or a fifth story about how Susie's drinking again, and we've gotten a good picture of that, I feel like it's appropriate to stop that story.
and you work with school counselors, because they only get 10 minutes, 20
Right.
minutes.
And a child's
kids
brain,
love-
yeah,
yeah.
and a child's brain is geared towards storytelling. I mean, it really is. So school counselors have to be especially vigilant about making sure they get the information that they need, but having the courage to cut off stories so that they can actually help the student.
For more information about impact therapy, look at the other YouTube clips or go to impacttherapy.com.